Go ahead and pull up my spot. Okay. All right. Well, I thank you for that wonderful introduction, and I really appreciate and feel very honored to be here at this amazing conference. When we saw the conference, it seemed like it had such a great alignment with a lot of the work that we're doing here in our clinic. And so I feel very blessed to have been invited to participate in such an amazing conference. So thank you so much. Today, I'm going to just move my screen a little bit over. Oh. As stated, I am a child, adolescent, and adult integrative psychiatrist. And usually what I tell people when I say I'm an integrative psychiatrist, they ask me what that exactly means. And typically, I'd like to say that I use a whole mind, body, spirit approach. And I really do look at the whole ecosystem of somebody's individual themselves as an individual, as a family unit, and then in a community at large. And so I definitely look at different types of community-based services, but I also look at holistic practices such as meditation, supplements. We do a lot of educational series and those types of things. We focus on exercise, nutrition. So we really try to bring in the whole package when we're talking about wellness. We won't go into too much of that today, but in general, when we talk about integrative psychiatry, that's kind of what we think about is kind of the whole package of how we get people well. So again, thank you so much for being here. And I don't know how many of you know this, but as we've had this unfortunate pandemic over the past year and a half, we've also had a pretty large uptick in mental health issues. And I do feel that the mental health pandemic is a second wave pandemic for all of us. Now, the concerning piece of that is that as these increased demands for mental health, continue to skyrocket, there's fewer and fewer mental health providers that are readily available to really help people through and navigate these difficult times. And this can be particularly stressful for parents who really are not sure where to turn to when their children and adolescents are struggling. And if you're a parent, and I'm assuming that there's several of you that are, sometimes it's really hard to know if this is normal adolescent child behavior or if there's something else going on. And if there is, where do we start? Who do we look to? How can we get them support? So in this presentation today, I'm really going to outline some major contributing issues that our youth are really facing today. These include development, stress, bullying, academic pressures, social isolation, and of course, social media. We're also going to discuss, the different ways that parents, grandparents, caregivers, schools, and community leaders can identify these struggling students or kids sooner and more effectively and provide more of a holistic support for them, which includes families, school systems, and the community. Because we're really wanting to strengthen the overall well-being, not only of our kids, but of our families as a unit and the community as at large. And lastly, towards the end of the presentation, I'm going to explore what we call the vast ecosystems of care that are available to you as parents, as teachers, and community leaders that can really help support our students. And we'll go into a lot more detail, specific school interventions, in addition to some parent groups and other sites of support. So usually when I ask parents, what is their goal for their children? And I would say 9 times out of 10, it's always something along the lines of, I want to raise happy, healthy, responsible adults. Now, that's what we all aim for. And then what typically happens though is, but then I get these, these hand raises like, that's the goal, but like parenting is really hard work. And so how do we manage this difficult job that we've been given that we love? And it's such a joy on the one hand, and then try to figure out how we can, really turn our kids into exactly what we're hoping for. This is often complicated by, the uniqueness of our kids, and if you have more than one child, you recognize that what worked for one doesn't always work for another child. And, I hear this all the time, like my kid doesn't come with a manual, they're different than me, we don't have personality, I'm not quite sure how to reach them or how to communicate with them. And that's another kind of stressful, kind of situation for parents. As I mentioned before, mental health issues like depression and anxiety are becoming increasingly more common. But what's difficult to know is the reason behind this increase in depression and anxiety in kids and teens. And there's so many causes, and it can be anywhere from a medical issue all the way up to like a bullying problem. And sometimes as parents, we're just not sure what's going on. And lastly, and I mentioned this before, when you have a question, when you're not sure what's happening and you try to figure out who can I reach out to, you're like, well, maybe I should call a therapist or a psychiatrist. And you find the wait lists are just quite really hard to get into them, especially if it's not an urgent issue. And so these are kind of the struggles that I hear from parents pretty much daily. And to me, that's problematic because, what we really want to do is understand what the cause is of our kids' depression or anxiety or anger or irritability or, isolation, and then figure out how we can get them the right intervention, because sometimes that intervention doesn't necessarily fall into what we call the mental health care system. There are a lot of different ways to help and support our kids and teen these days. And I'm going to walk you through some of those options.
Shall I put the poll in the chat now?
Sure, that would be great.
Okay, participants, we'd like you to answer 2 questions in the poll. First one, are you a parent? Yes or no? Okay, mahalo to those who are answering. We'll just give another 2 seconds. Okay, ending poll now. Thank you. Here are some of our results.
Right.
We have quite a mix. We have one more question to also include your children's ages. If you are a parent, you can select more than one. Mahalo for responding so quickly.
Oh, they're really fast.
Yeah. And poll is closing in the next 5 seconds. Mahalo again. Here are some of our results.
So thank you so much for filling that out. So we have a nice wide range of ages, and I think that that's going to be really helpful for me to kind of guide what we kind of present a little bit more as we go forward in this presentation today. Move that poll over here. So why don't we go ahead and just jump into some general causes of mental health symptoms that I typically consider. And as parents, and non-parents, and forever who's in the other group, I'm assuming it's teachers and some other caregivers. Some of the general things that I consider when I see somebody struggling with sadness or worries or those types of things. And one of the first things that I always do, because I'm a psychiatrist and I'm medically trained, so I'm always thinking about a medical cause and whether or not there's any specific medical issues going on. And then I might look at maybe a genetic predisposition, the impact of stress, development, psychological issues, personality traits, social issues, academic and learning. And last but not least, and one that typically I see and surprises parents out of nowhere, is substance misuse. And we're just going to jump in and talk about not all these in detail, but a few that I think are particularly important. Now, before we jump into that, now that I kind of lay those out, everybody always asks me, so why are kids at risk for mental health issues? And the way that I like to simply answer this, well, it's brain development. And I don't know if you've probably heard this, that, teens' frontal lobes haven't quite fully matured, and that's true. But the other complicating piece is not only is the frontal lobe is underdeveloped until about anywhere between 20 to 25, but the limbic lobe, which is the amygdala and the hippocampus, it's at the base of the brain, is turned on usually around puberty. So in a sense, it's a mismatch in development because we have a frontal lobe, which is our CEO, and it's necessary for goal-directed behavior, social and emotional functioning, learning, planning, goal-directed activities. And that's kind of lagging behind the structure in our brain called the limbic lobe, which is our drives, urges, and most importantly, our emotions. So anxiety and depression and anger and irritability are driven by the limbic system. So that's turned on with hormones. So when we get when we hit puberty, we get lovely estrogen and progesterone and testosterone. And there's tons of receptors in the limbic lobe that increase in functionality. And now we have, a teen or, even an older teen who has a very, you could say, mature limbic lobe, but an immature frontal lobe to tampen down and say, hey, listen, you don't need to be this anxious, or maybe that high risk behavior is not in your best interest. And that's how teens typically get themselves into trouble. Yeah. Now, what further complicates this kind of mismatch in these two areas of the brain is if there's any other issue related to learning disorders, whether or not there's some developmental disorders like ADHD that play a role, if there is any history of trauma, which also changes the way the limbic lobe works. So any stress, which also can change the dynamic between these two regions, occurs, you're going to see a mismatch and increased symptomatology. And so I bring this up because I'm going to kind of talk about this mismatch a little bit when I talk about some of the other ways and other reasons when I talk about some of the reasons that kids get depressed and anxious, those types of things. Okay. So let's just briefly look at some of the medical causes that I think it's important for parents to at least recognize in their children and adolescents, especially if they're struggling with depression, but this can also be a depression and anxiety. But thyroid hormone is a big offender for mimicking psychiatric symptoms. And so it's always important to make sure if your child is more anxious or depressed and really tired, to think about getting their thyroid checked. Same thing with adrenal issues and also diabetes. There's autoimmune issues, which can unfortunately either mimic depression or anxiety, or can actually cause it due to just the underlying autoimmune disease and how it impacts the body. There's also nutritional deficiencies. So I make sure when kids are not feeling good, to make sure you get just some general labs, check B12, folate, vitamin D is, for some reason, tends to be low, especially if we're not getting out in the sun as much as we used to. I often will look at that, especially during the winter months. People are starting to noticing their moods downside. And this is for adults and kids too. If you're starting to feel just more tired and blah, or more sad or anxious, you might want to either take some vitamin D or at least get it checked out to make sure that's not contributing to any issues. There's also infectious causes. Mono is a big one that I run into, especially for teens, and they look like they're tired all the time. They're lethargic. They can't get out of bed. Sometimes it can be mistaken for depression when in fact it's actually an infectious issue that needs to be addressed. So there's also some neurological issues like seizure, MS, hormones, which we talked about. This is particularly important for our girls who are now post-pubescent. And as if you know this or not, but earlier on when younger girls start having their regular periods, it's usually quite irregular, and their hormones are just kind of fluctuating. They're not going evenly throughout their cycle as they do as grown, more mature women. And so they can have spikes and bursts, and each cycle could be different. And so it's really important to make sure that you time the symptoms if your kid's not feeling very well, and especially as a girl, you could actually time that over the course of the month to see if there's any correlation with their hormones. And the nice thing about hormones is the estrogen and progesterone, they peak and trough at different times of the month. So if you do a nice charting, you can actually get a pretty good idea of where the imbalance is. The other thing to think about is just your basic diet and gut biome. We won't go into that much in this talk, but there's a lot of emerging research that suggests that poor diet really impacts our stomach lining and our intestinal lining. And that poor diet then causes leakage of inflammatory products into our blood, which leads to generalized inflammation throughout our system. And we have inflammation in our body. It gets into our brain too. And our brains really are not that happy when there's inflammatory things flying around in it. And it can really cause a lot of kind of depressive types of symptoms. And then in general, just inflammation. If you think about things that cause inflammation in our society, it's usually due to poor lifestyle choices, diet, and poor nutrition is the same thing as diet, being overweight or smoking or doing drugs and alcohol. All those lifestyle issues can really impact and increase the inflammation in our bodies. So next, let's talk a little bit about the impacts of stress and how that impacts not only us as adults, but as our teens and our children. In general, and this is something I like to stress to everybody, is pretty much any kind of stress, any kind, good or bad, affects the body the same way. So we've all heard of, people are getting married and you think, wow, they should be the happiest. They're like getting wedding and they had this awesome time planning their wedding, but it can be extraordinarily stressful. And your body, even though you're getting married and you're so happy to get married, but the thing is your body interprets that change and everything goes around it as a stress. Same thing with kids who go to college. Like, yes, this is an amazing experience. It's going to be awesome. They're looking forward to it. It's a really good thing to happen to them, but it's a major change and it's a stress, and the body interprets it as just a blank stress, not a positive or negative, just stress. And so if you think about all the things that we're going through on a day-to-day basis, these stresses start to add up. And whenever our body detects either acute or chronic stress, it releases these really good but not so good hormones that are called cortisol. They're released from our adrenal glands to help us manage stress. Now, one of the problems with cortisol, it's great for acute stress, but if it's constantly being released, or if you're having a lot of stress and transitions in your life, then that cortisol is constantly being put out into the body, which again impacts the brain and can lead to inflammation, and also leads to increased sympathetic tone, which also causes higher levels of depression, anxiety, and you probably all have felt this, just feeling just quite frankly burnt out. And so I just like to let people know that when we have massive different changes in our life, and our teens and children in particular typically have a lot of transitions, whether it be from changing schools, moving because their parents got a new job, fluctuating peer groups, academic stressors, sports, you name it. There's a lot of things going on in their life that can be stressful. And so really paying attention to that amount of stress and transitions in their life can be an important part of parenting work, and just being able to predict when your child may or may not be doing well, and then linking it back to one of these kind of stressful events. Okay. So I would say, though, even though I talked about some medical issues, talk about a little bit about development and stress, I think one of the biggest areas that our kids struggle with today is just some of these big social issues that they're all experiencing. I would say with increasing frequency over the past, I would say 5 to 10 years. I think bullying has always been around, but I think there's a different flavor of bullying now, where it's not just an individual or in the school setting, but because of social media, it can really be a global bullying event, which can be particularly traumatic for kids and adolescents these days. Obviously, if your teen or child struggles with just general peers or struggles making friends, that can be a major issue for them, because for younger teens and older teens in particular, their goal is supposed to be finding peers and connecting with them in a way that they are supported through their development. And when we don't have that ability to make the connections the way they do, that can really take its toll on their self-esteem. They might feel that they're different, they're not good enough, nobody likes them, and it can really kind of spiral into a lot of negative thinking patterns, which can then lead to kind of depressive symptoms or anxiety symptoms. Another major stress is, again, I kind of mentioned it before, is social media. I think our kids are starting to, they're not connecting the way that they used to, like one-on-one, actual facial interaction, calling people on the phone. Now it's like a 3-word answer, or it's an emoji, or it's a wave. And so they're also getting kind of immediate and positive reinforcement continuously when they're checking their phones daily. And it can actually set up some addictive types of traits where they're being rewarded continuously. And so it's hard for them to then maintain kind of normal relationships when they're not getting immediate gratification and satisfaction. I think social media is particularly hard on our young girls. They're constantly being bombarded by what the ideal woman may or may not look like. And there's a lot of social, pressure to have that perfect figure, that perfect face, that perfect skin, et cetera, et cetera. And so I know there's a lot of girls that struggle with just the image of beauty and how the social media kind of perpetuates that for them. Another major area that I run into is academic pressures. And I mean, I don't know about you, but I when growing up, I think I may have taken one advanced class, maybe at some point in my high school career. But nowadays, these kids are like 5 AP classes. They're taking, half of them have like a full year credit for college by the time that they're going off to college. And I just think there's just an increased pressure on these kids to perform and get that college resume just right so they can get into the best school, which makes a lot of sense. I completely understand that. But sometimes these kids put so much pressure on themselves, and sometimes it's not even parents, it's the kids themselves that are putting kind of unrealistic expectations on themselves on what they can and can't do in order to get into a good school. The other thing that I run into is sports pressures. I've treated a lot of individuals who are at the top of their sports, whether it be in gymnastics or skiing, or some of these really ultra competitive types of areas. And that can be a major stress for them. And, working through that and thinking about how that impacts them emotionally is really important. And lastly, the other thing that I think that's particularly pertinent to our kids and adolescents is sometimes our parents and youth have different goals and expectations. And this can be a difficult one to try to kind of navigate. And I can give you an example, for instance, of, some parents might expect straight A's out of a child who may be, more of an average student. Another example could be, parents who are particularly religious, but they find themselves parenting somebody in the LGBTQ population or youth. And so trying to navigate those trickier situations when, parents have an expectation and an upbringing that's a certain way, and then their child has a different view. And those views can be hard to navigate. And sometimes it can actually be harmful to our teens if they feel like they're disappointing their parents. And I know teens don't act like they care if they disappoint us, but they actually do. And so it's something to consider when we're talking to our kids, like, you don't want to shame them per se for some of their different beliefs or value systems, because it does really impact them in their mental health overall. Okay. So the last big category for things that can contribute or look like mental health issues that may or may not be is substance misuse. And usually the red flag that I get in my office every day almost is when I see a new family and they say, all of a sudden my kid is acting completely out of character. They're completely different. I don't even know who they are. They changed overnight. And then I was like, well, are you worried about drugs and alcohol? Oh, no. I know they would never use that. Well, we do a drug test and lo and behold, there it is. So that to me is really something to watch out for, because it can change your child's mood, attitude, behaviors so quickly, and probably faster than any other kind of underlying medical or mental health issue. And maybe more similar to something like if a major traumatic event happened, because that could obviously be, your symptoms would occur pretty quickly. But I tell parents that this is an important thing to just watch out for, because all drugs and alcohol and marijuana, and everybody will dispute me on this, but yes, marijuana too, can lead and change the way our teens' brains work and lead to symptoms of depression and anger and irritability and heightened anxiety, and sometimes even more serious symptoms. And so I just lay that out there that if you see any changes in your child's mood that's pretty dramatic, or changes in behavior, or changes in friend group, like automatically, or if they start quitting everything that they used to love and they're isolating, you may want to think, geez, I'm going to make sure that they're not using any kind of substances, because treating a substance misuse issue is different than how you would treat a mental health issue. And so you really want to make sure you get that right. Okay. So what are some general warning signs? Because I want to give you, I always hear this. So, what are some of the main warning signs that I need to be looking out for as a parent, as a teacher, as an aunt, as a friend, and those types of things? And usually you want to, first of all, think about who you're considering. So for instance, if your child is always kind of on the little bit of an anxious kind of a child, or a little bit shy, then that's not abnormal. That's their personality, and that's okay. But it would be any changes from baseline that you want to look out for. So any abrupt changes in like personality or what they're wearing, if they seem more isolated from parents or peers, if they refuse to talk openly with parents. Now, if they've never talked openly, and so that's not a change, but if they're usually just, very vocal, and you had a great relationship, then all of a sudden, their lips are sealed and they give you one word answer for the next several months, then that's probably a warning sign that you may want to consider something is going on. Poor appetite or restricting food intake, or if you've noticed they seem to be losing a lot of weight, or you feel like they're covering up their bodies with multiple layers of clothes, that might be something to consider as well. Sleeping too much or too little. And I know this is sometimes hard when teens especially are on their growth spurts, and sometimes they can sleep 10 to 12 hours a day. I get that, and that's pretty common during certain periods of growth and development. But if they're sleeping that long and they're not getting out of bed and they're taking naps throughout the day, that's when I think, okay, this is more an extensive amount of sleep than they would normally need, especially if they're waking up and they're not feeling rested. Another thing to look out for is obsession with social media. And I always ask, well, what does that mean? Because if you have a phone and you have, any kind of Facebook or whatever, we're all kind of like on our phones and our social media probably too much, including myself. So I'll throw myself under the bus there. But for teens, what this really looks like is they're on it all the time. They don't make any eye contact. And when you try to take it away from them, they have an extraordinarily strong reaction. Like it's over the top. Like, if they said, oh, I don't want to give my phone, but fine, here you go, versus like a full on, anger outburst, that usually signs that there's maybe some kind of overuse issue going on. So just a few kind of other things to consider. Obviously, high-risk behaviors, stealing, lying, legal issues, alcohol and drug use. And I say excessive because, we all know that kids and teens are going to experiment here and there with different things. We all hope they don't, but to say that they won't would be unrealistic, I think. But, occasional experimentation is a lot different than, daily use, using at home alone to help them sleep, consistently missing alcohol in your cabinet, those types of things. You just want to kind of keep an eye out for that. And I also put here moderate to severe irritability, including aggression. And again, I usually try to say moderate because, sometimes our kids and adolescents, because their frontal lobes, there's still that mismatch, remember, they do tend to be more irritable. They do find it harder to manage their emotions on a day-to-day basis, and that can change throughout the course of their development. And it should be mild, occasionally mild in severity, but when it gets more to the moderate to severe, that's when you want to pay attention. The other one is oppositionality. Again, I put it in the more moderate to severe, just because part of growing up is, rule breaking and trying to figure out what you can get away with. as it, I've been there. I mean, I remember being a teenager and I tried to, do what I could to bend the rules here and there and maybe not, always follow the directions and here, but it was on occasion, it wasn't all the time. And so that's what we just want to keep in mind is, are these changes in their personality behavior, are they mild, moderate, or severe? And that kind of gives us an idea of when we should really start looking at ways to kind of intervene or at least find out some more information. The other thing I see a lot is kids who used to love either sports or dance or their hobbies, and all of a sudden they just quit everything and they don't want to engage at all. And then the last one is, physical complaints. If your child is always complaining of stomach aches or headaches or has lots of pains or muscle aches, and it tends to occur like Sunday evenings or Monday mornings, always in kind of relation to school or always in relation to a specific activity, that is something to keep in mind, that there might be something else going on. Okay. So now that I talked a little bit about some of the warning signs, I want to talk a little bit about, kids at risk. And I think as teachers, as parents, as community leaders, we really want to keep an eye out for those kids who may fall into this category of high risk. And in general, any history of mental health issues or learning issues is automatically places a child at a higher risk of developing more severe issues. Bullying, including the past and present. I mean, I even have adults that I treat who still talk about, the time in 5th grade where they were, bullied pretty extensively. And it sticks with people, and it can stick with people for forever. And so it's really important to tease that apart, in recognizing that even though they may not be getting bullied now, the prior history of pretty significant bullying can impact them in the future. Obviously, a family history of mental health issues, which is just more of a genetic component, bring your child at risk. And then kind of what I talked about was stress and any major transitions can also increase people's risk for, and kids, increase our kids' risk for developing mental health issues. And sometimes I'll even have parents, and you can find these online too, there's like a chart of stressful events, and you can click off all of the stressful events in your life or your kid's life, and you add them up. And they tell you if you have a certain amount, then that you're increased risk actually for developing some whether it be burnout or anxiety or depression or something else. But as parents and teachers, we kind of know what kind of stress is going on with our families. And just knowing that, again, will help you kind of predict, prevent, and maybe help intervene if your child is undergoing a lot of stress. Some other key things that put your child or children in general at risk: a history of a trauma or abuse. And witnessing abuse or trauma or domestic violence is a very big risk. And that includes sibling on sibling violence. And I don't think we talk enough about kids being bullied at home by an older sibling, or another sibling might be struggling with their own mental health issues and they take it out on a younger sibling. So I always stress to parents that it's important to make sure that you're watching out for any kind of, bullying in the home, because it happens a lot more frequently than I think we are aware of. Minority populations, history of head injuries, history of chronic medical conditions also places our kids at risk. Pain in particular, I just wanted to highlight that, is very important because, usually we don't think of people being in pain when they're young because they're supposed to be healthy and things of that nature, but pain can be a very hard thing to manage, especially chronic pain over many, over years. And I've seen a lot of kids that have had major surgeries or have had certain types of illnesses where they've been struggling with chronic pain, and that really takes its toll on individuals' mental health overall. Okay. So I wanted to kind of speed up a little bit and talk a little bit about the ecosystems of care. So now that I kind of laid out who's at risk, what are some of the risk factors, what if I got a call from a mom or a teacher and they said, well, I think something's going on and I'm not really sure what I should do. And I usually like to just talk about the landscape of an ecosystem of all the different ways we can intervene and get our kids, families, teens back on track. And this ecosystem of care includes individual types of interventions. It could be family and peer interventions, educational system, medical system, spiritual, religious systems, community resources, and a lot of other types of things as well. But today I just want to focus on two major types of systems, and one of them is the ecosystem of educational system. And a lot of people think that schools are just about academic learning, but they're about so much more. And it's about emotional and social learning as well. And if you think about the time that our kids spend in school, it's quite significant. And they spend most of their, like half their lives there, at least for up until the age of 18. And so we really want to look at some key entry points to care here. And there's certain places like academic and emotional health accommodations, which are IEP and 504 plans to consider if your child's struggling. But usually if you just talk to the academic advisor and say, I think my child might be struggling a bit in school, you know, what can we do? And they can kind of help guide you through the process of determining if there's any underlying learning issue or whether or not they are seeing anything emotionally or that this change with your child's life, and whether or not there's certain accommodations that can be put into place. There's also, for most schools, counseling available. And there might also be some peer groups that your child or adolescent might want to engage in that would be really helpful for them, especially if they might be struggling a bit socially. There's anti-bullying programs. I love the No One Eats Alone program that's out there in school districts. Students Against Destructive Decisions, which used to be Students Against Drug Driving. There's great diversity groups out there, special interest groups. So sometimes, you know, just getting our kids involved in group settings in the school can also really help with that emotional and social learning. There's also some great peer and adult mentorship programs. Coaches are great for, you know, checking in. You know, if you're worried about your child and they're involved in the sport, check in with the coach. They have a different relationship with their coach, right? And they might actually be more open and honest with maybe some adult outside figures than they might be with their parents at any particular time. But there's also some great opportunities for volunteering and community service within the school settings as well.
Dr. Lopez-Larson, would you like a poll to see what skills or knowledge? Okay, participants, let's get ready for another poll. This question is, what skills or knowledge do you need to become a more confident parent or caregiver? Feel free to select more than one choice. Probably give you about 10 more seconds to fill it out. All right. Thank you again for participating in the poll. Here are our results.
Great. Well, that's awesome. Thank you so much for sending in that poll. And that's exactly what in line with what I hear in my office every day: conflict management, negotiations, discipline, communication, and just general knowledge is what all parents and teachers and caregivers want. Because, you know, again, parenting can be hard sometimes. And I think that's kind of what we were thinking about. We actually, I'm going to jump into talking just a minute about, we put together a program that's called the Confident Parenting Program with this exact kind of issues that we want to address in mind. And some of the goals of this program, and this would be an example of more of a group types of programs. And the goal is to be confident in your parenting. Our goal with this kind of group was to provide another avenue of care and support and help parents really gain the tools and become experts in their family and their children. And obviously the group was designed for parents to become experts in navigating difficult issues, which you kind of outlined here, particularly in regards to conflict management and negotiations, but also to help parents have a better understanding of why kids use drugs and alcohol, or what bullying is all about, or how they can manage, whether it be social media issues, depression, anxiety, etc. And the other goal of this group, and again, it falls in line with the ecosystem we're trying to create, is to help parents build a community of support for themselves, their family, and others, and really explore how our parents and children can walk side by side in these groups in order to really make a really good difference and change within their family system. And so I'm just going to describe briefly this program. Obviously, module 1 is really about helping the parent figure out who they are and what kind of parent they want to be and empower them to be confident in what they're doing. And then module 2, establishing and building strong relationships with your children, which typically starts with getting to know them, trying to figure out what their personality traits are and how to mesh those with those of their parents, and really give parents some really strong tips on how to engage them in relation. The third part of this program is really specific parenting strategies around the issues that we talked about. In module 4, we're really trying to build a family, child, community-based ecosystem to help support them. And then the last part of this will be a parenting by design kind of module, where we're really helping you design a parenting plan that's specific to your own family. And the reason I'm sharing this with you, because we wanted to add another type of experience in my clinic to parents overall that provides some group support, some community support that gives them the basic skills and knowledge that they need. But again, in a more of an ecosystem, in a more of a community-based way. So I'm interested in, and I think it's on the next slide here, is if you were to engage in a program like this, what would be some of the things that you would be most interested in learning more about? And I believe we have a survey on that. If you could pop that up. And I think
here's the last poll of the session. If you could please select from one of the modules, if you could enter your responses. Again, you can select more than one. We'll give you another 5 more seconds to complete your response. And thank you again. Here are the results.
Thanks. And that's just about, and I love that, establishing strong relationship with children is comes up on top, because I think in the end, we all want to not only have happy, healthy, confident kids, but we want to have a great and amazing relationship with them now and in the future, because that's what it's all about, right? Developing and maintaining these relationships with our family and our children. But I got to say, any relationship is hard work, and knowing and understanding each other is the ultimate goal for a lot of what we're all talking about, I think, in this seminar and beyond. So with that, I thank you guys so much for joining me. And, I did outline some major factors today that contributes to our use, increasing mental health issues. We explored warning signs, we talked about risk factors, and I also kind of introduced you to how I think about the whole ecosystem of a child and family, and how I like to think about intervening, whether it be from just a little bit of anxiety to bullying to beyond. So, thank you so much, and I'm going to open up to questions. And please let me know if there's anybody out there who has anything they'd like to ask me.
We do have a couple of questions from the chat that I pulled out. This is from Trixie, and Trixie asks, how do we redirect our teens to build self-esteem once the self-esteem that they had once had 2 to 3 years prior to depression?
Yeah, that's a great question. One of the things that I'll typically recommend for that, and depending on why they lost their self-esteem, I'm assuming there's a specific thing that may have happened, whether it be a bullying event or things like that, is reminding them of how strong they were back then, and what changed over the next couple of years. And you can talk about the impact of whatever may have happened those 3 years. And then you want to engage them in things that they feel confident in. So, sports, whether it be like you're an amazing reader, let's focus on reading skills or finding those areas where they are really strong and pushing those directions so that they can develop some internal self-confidence again. Because some depression really wreaks havoc on our self-esteem. But you can also remind them that's exactly what depression does. And we are more than our depression. We're not depressed people. We just have depressive symptoms sometimes, and they do a number on our brain. And so that's kind of where I start with parents. I also teach them how to help their kids talk back to our thoughts, which can be negative sometimes. And we're often very self-critical of ourselves, and teens and kids are no different. And so we talk about skills to say, okay, well, what's that nasty thought that keeps popping up? Well, let's challenge it with this. And I even have people write down their rebuttal. So every time that nasty little thought comes in, and for kids and adolescents, I'll sometimes call it a nickname, like something not cute, but like, oh, well, that's, Ed talking to me again. It's not, so you kind of dissociate that negative thought, kind of laugh at it, try to make jokes about it, and have your rebuttal set. So, challenging negative thoughts, building confidence by, trying things out that's in their wheelhouse, things that they have a lot of strength in. And then talking to them about the impact that depression has on the brain and, how that it doesn't necessarily mean anything beyond that they just had this depression, but now it's gone. And they're still the same person they were 3 years ago. So those are probably my top 3 tips off the top of my head right now.
Mahalo. We do have a couple more. I know there's 1 minute left in the session, but if we can ask one more question. This comes from Joanne. How can you convince a parent that parenting tools and strategies can help with their relationship with their child when their child is making poor choices?
That's actually a really good question. And I might need a little bit more information, but I think in general, you want to speak to the child's strengths, right? And just say, geez, they're, academically gifted, or they're socially gifted, or, they're sportsly, they're gifted in these certain ways. So talk about the strengths first, but say, I'm worried that this, one particular behavior or this particular thing that's going on is holding them back from being the amazing, confident, successful young man or woman they're going to engage in. And I know there's other ways to address this outside of seeing like somebody like me, because usually when they hear like you got to learn some tools and strategies, they're thinking, oh gosh, I got to go see a psychiatrist or a therapist, right? But there's other ways to get these skills that are outside mental health, in mental health clinics. And from my perspective, there's still a lot of stigma around seeing a provider like myself. And so that's why I was offering some other solutions, whether it be parenting groups, parenting skills, building community supports, to help engage and bring people in and normalize this. Because again, raising kids is hard, and let's just like figure it out together. It takes a village where none of us are going to do it right. I don't even do it right most of the, well, I'm hoping I do it right most of the time with my own daughter, but there's times where I'm like, well, that wasn't very smart. I can't believe I just said that, or I can't believe I just gave in to this, crying because she wanted a toy, or, we've all been there. And I think that's what we need to do as a community, is just normalizing how hard it can be to be a parent. Know that none of us can be perfect, and we just kind of just help each other, support each other. And I think if you come about it in that kind of way, I think they might hear it a little bit better.
We want to thank you, Dr. Lopez-Larson, for your time, for all this valuable information shared today, and to our participants. We mahalo you for joining our conference today. Information on Dr. Lopez-Larson was in the chat. Here it is also on the screen. Friendly reminder, please do your survey to give her feedback. We appreciate it. And lunch is to follow. Again, the Zoom link for our lunchtime mele is in the chat. Please bring your ono meal and enjoy mele. 2 more to go in our Ohana Engagement Conference, session 3 and closing session. Hope to see you all. Mahalo. Have a great day, everyone. Aloha.
Thank you so much.